Hi everyone, it's Claire Jarvis here at Restore Fitness Therapies, and in this video I want to talk to you about managing back pain during pregnancy and the postnatal period. It can be a real bugbear for a lot of people, and it can really make what should be a really joyous, magical time pretty miserable, quite frankly, and we don't want that to be the case for you. So in this video I just want to explain to you why it is that you might be so much more vulnerable to back pain during pregnancy and as a new mum, and then what you can do about it. So first of all, during pregnancy, you're getting much bigger in the upper part of your body as well in preparation for breastfeeding. Your rib cage expands by a good couple of inches there. Your breasts start to get larger as well in preparation for milk coming in. So the top half of your body has gained a couple of pounds here. And what that means is that you're going to start hunching forwards and leaning forwards because this weight is going to start pulling you forwards basically all the time. And what that means is we're shortening our chest muscles, our upper back muscles becoming weakened and lengthened. We're starting to hunch forward, so our spine is starting to curve, and then because we want to keep looking forward, we start to push our chin forward as well. And then by the time we've done all of that, we can end up with really horrible upper back pain. The second thing that's happening during pregnancy is, particularly as we go through the latter stages of pregnancy, our belly is getting a lot bigger, and all that weight is being pulled forwards. And what that does is take your spine from a lovely neutral position into a really over curved lumbar spine position. So those vertebrae are now being pressed together, compressed together. The nerves in there may be compressed as well if you've ever had a little bit of sciatica down there during pregnancy as well. And now you're left with lower back pain. So you may have experienced one of those or possibly even both of those. And it's really uncomfortable, and it can really take the joy out of your pregnancy if you're suffering with back pain. And then postnatally, what happens is, one, our bodies don't just go back to normal straight away. It's going to take some time. If you're breastfeeding, you're still going to be carrying that extra weight of kind of a heavy breasts and milk production for quite a few months there. It's going to take a little while for our bellies to sort of shrink back down again into position. But now, just at the very time we've got probably our core strength is at its lowest, we're now carrying around a baby with us. We're maybe pulling a pram up and down stairs. We're getting car seats in and out. You know, we're probably sleeping in awkward positions, feeding in awkward positions. It's basically a total recipe for back pain disaster. So being pregnant and being a new mum presents us with a lot of challenges for managing back pain. But the good news is you can overcome those. So there's lots of functional things that you can learn to do, just doing things differently, which are going to stop you from putting your back in a really vulnerable position. So one of the big ones for a lot of people is if they're bathing their baby and using maybe a bath seat, they're leaning over the bath and probably putting their back in a really vulnerable position. And we're able to show people in our classes some great functional ways to get around that. So we're not suggesting you don't do those things because they need doing, but we're just teach people how to do it slightly differently to look after their back and still have a great experience with whatever they're doing. Same with lifting and carrying babies out of the car or car seats or shopping bags. There's just a good way to do it, which is going to look after your back, and then there's a really poor way to do it, which is probably going to really hurt your back. And unfortunately, most people just don't know how to do these things properly. So that's what we teach people in our postnatal classes as well. So basically, it's just about changing the way that you do things. And the reason Pilates is so great for that is because we focus on a couple of really specific things. The first thing is we focus on refinding your core strength again. As we mentioned, core strength has really taken a tumble during pregnancy and through birth. So we help you to very safely rebuild that core strength. Once your core is nice and strong, that's going to help you stand up a bit taller. It's going to start improving your posture and start reducing some back pain. We also help you think about this upper body posture. So if you have been in this position, we'll help you to adjust your muscle tension and help you pull everything back into position again. It's going to make you feel a ton better, but it's also going to align your body, get your posture nice and correct, and it means that as you're doing these functional jobs around the house and with your kids, you're not going to be putting yourself in a really vulnerable position. So yes, our bodies are really vulnerable to back pain during pregnancy and postnatally, but there's tons that we can do to avoid that pain or get out of it if we have got ourselves into a position of struggling with back pain. So you really don't need to suffer. Please don't think that this is just a part of pregnancy and it's a part of new motherhood. It doesn't have to be at all. There are absolutely things that you can do, and a lot of the exercises we post are going to help you with that. But if you would like a bit more of a helping hand, as always, you can always reach out to us. We're very happy to have a conversation with you about what you're going through, what kind of help you need, and to see if we can help you. So I hope that video has been useful, and I look forward to seeing you in the next one.